Have you been diagnosed with a thyroid condition? Most commonly, hypothyroidism. This is when you get your test results back, you see your TSH levels or your thyroid stimulating hormone levels are high, your T3, your T4 levels are low. Voila, you get diagnosed with hypothyroidism. And here, take this prescription for synthetic thyroid, and you need to take this for the rest of your life. Question I always tell my patients is ask why. Why is my thyroid underproducing thyroid hormone? Thyroid issues most commonly are actually a result of a systemic problem. If you don't get to the underlying issue that's causing you to have underactive thyroid, then you're never going to get the best results. Hi, I'm Dr. Amanda, and this is Freely Shine with Dr. Amanda, where we talk about everything related to whole body health and wellness, whatever it is, whatever you want to talk about, we're going to talk about. Thanks for joining me, and my mission, as always, is to empower and encourage people to shine their brightest from the inside out with less drugs, less surgeries, less external things trying to make ourselves feel like enough, and understanding that we are enough no matter what with what we have been given. You are enough. Is that motivating? I don't know. I feel pretty motivated right now. Today, what we're talking about is thyroid health. Your thyroid gland, it is a gland that sits here in your neck. It's butterfly-shaped, beautiful little gland. Extremely important because it produces your thyroid hormone, T3, T4. These hormones are essential for your cell's ability to metabolize and use energy. This is why one of the most common symptoms when you have any sort of thyroid condition is fatigue or loss of energy. There can be a lot of underlying factors that can affect our thyroid health. And if we don't dig deeper and uncover the root of why our thyroid isn't working the way that it's supposed to, we're going to miss a huge piece of the puzzle. Thyroid issues are extremely common, more common in women than in men, and we know how common it is simply by the fact the fourth most prescribed medication in the United States is levothyroxine, or a synthetic thyroid. The question is your thyroid problem a thyroid problem? Or is there something else underlying to why your thyroid is not functioning the way that it's supposed to? The way the thyroid works is there's a hormone that released from our brain called TSH, thyroid stimulating hormone. I give you two guesses what its job is. Yeah. The job of TSH is to stimulate your thyroid to produce T4 and T3. T4 is the inactive form of your thyroid hormone. The majority of the hormone produced by your thyroid is T4. And 80% of that T4 gets converted to the active form of your thyroid hormone, T3, in your liver. Just right there, understanding that when it comes to your thyroid health, your liver health is extremely essential. There's three different things that I'm going to talk about that could be underlying issues to why your thyroid isn't functioning the way that it's supposed to. The first reason why you may be having low thyroid function is if you have poor bile flow or poor bile production. Bile. What? How does this affect your thyroid gland? You're like, what's going on? Well, bile is actually produced by your liver. It's stored in your gallbladder and then is released into your intestines to allow your body to absorb fat. Bile triggers the release of an enzyme in the liver that converts T4 to T3. In order for you to produce active thyroid hormone, and in order for that active thyroid hormone T3 to then be able to go to your cells, you need to have proper bile flow. If you don't, it's going to decrease the amount of active thyroid hormone you're going to have circulating in your system. There's actually a study done in Finland that showed that people who have decreased bile flow are 7 times more likely to be diagnosed with hypothyroidism. And it's because of this connection to the synthesis reaction of T4 to T3 as a result of the enzyme that is released as a result of bile. If you are not absorbing fat properly, this could mean that you may have an issue with that bile flow, and therefore you could end up with an issue in through your thyroid gland or your thyroid function. Second systemic issue that you could be battling if you are dealing with thyroid problems is estrogen dominance, or having too much of the female sex hormone estrogen circulating in your system. This is extremely common in females of childbearing years postpartum, because after you deliver a baby, your progesterone levels drop and your estrogen, so you have an estrogen to progesterone dominance. So your estrogen levels become higher, and this is why it's extremely common for women, especially after their first child, to become diagnosed with hypothyroidism, because of that fluctuation in their female sex hormones that leads to an estrogen imbalance. And estrogen binds to your thyroid receptors. So it decreases the production of your thyroid hormone by binding to those receptors and preventing TSH from stimulating your thyroid. Estrogen dominance can also be a result of exposure to exogenous estrogens in our environment. So exogenous estrogens are estrogens that come from outside of our body that get inside of our body, whether it's through the air we breathe, ingestion, ingestion, yeah, you're ingesting it, yeah, that's the word. Or it can be through our skin. It's really common to have exogenous estrogens present in our beauty products, our skin care, our hair care, even our cleaning products have a lot of these exogenous estrogens, and they act in the body as similar to estrogen, and they'll bind that thyroid hormone the same way endogenous estrogen, or estrogen that you produce, will as well. So making sure we're limiting that estrogen load. This also can affect your liver, because when estrogen levels are really high, your liver function is working so much to detoxify, because it's too much estrogen and it can create a toxic load on the liver. And so the liver has a lot of work to do. And if it's busy doing that, it means it's not going to be busy doing the synthesis and conversion of T4 to T3. So because liver is so important for synthesizing that active thyroid hormone, if you have too much of any toxic chemical, or if you have too much estrogen in your body, then your liver can become overloaded. Third thing that is underlying to a lot of thyroid conditions is stress, an imbalance in your stress hormone called cortisol. Cortisol, similar to estrogen, binds the receptor sites on the thyroid gland and decreases the production of thyroid hormone. And so if you are dealing with really high stress, really high cortisol levels, you're going to have really low thyroid function. If you are in a stressful time in your life, you go to the doctor, you get blood work done, you see that your TSH level is high, but your thyroid hormone levels are low, which means your brain keeps producing that TSH because it wants you to stimulate thyroid hormone. It knows that there's not enough of it, but for some reason your thyroid gland just isn't producing it. Well, if you aren't measuring also your stress hormone levels, if I'm just giving you synthetic thyroid and saying, oh, here, this will make you feel better, and not getting to the underlying issue of the stress, well, are we ever going to get to the root cause? So addressing that root cause, dealing with that stress, giving you ways to cope with it in healthy ways, is going to be more beneficial to your body and your health in the long term, versus giving you a prescription for synthetic thyroid that a lot of times you'll have to take for the rest of your life, and it can be extremely difficult to wean yourself off, because once your body's been given the thyroid hormone, your thyroid's like, I don't need to produce this anymore. You're ingesting it. I'm going to just stop working. And your thyroid, the balance of your thyroid hormones is so essential to the balance of your health, your energy, your metabolism. It's really not something that you want to overlook. Don't ever be afraid to ask the question why. Why is my thyroid not working? Why are my T3 levels low? Why are my T4 levels low? Is there something else going on that we could be overlooking? Hopefully this quick little discussion on thyroid health and the thyroid gland and other underlying issues to your thyroid health or thyroid function. Hopefully this has been enlightening to you and can help you dive a little deeper. And if you're anything like me, I have a family history of hypothyroidism. My mom has it. My aunt has it. My grandma has it. So for me, learning about my thyroid and learning what I could do to keep it healthy and understanding how does it work in my body in a systemic way has been really important, because I want to make sure I'm doing everything I can possible prevent issues in the future. Because we have this idea that, oh, well, my grandmother had it or my mom had it, so it's inevitable. It's something I'm going to deal with. I'm going to have hypothyroidism. You are not predestined to anything. You have a lot more control over your health than you think you do. So never be afraid to do your own research, to question me, question any doctor that you see, because the only person that's going to take number one priority of your health is you. And the best doctor in any room that you walk into is you, is your own body, and the power that it has to heal itself if it's given the right ingredients, if it's given removal of any interference to its function. You have to learn and grow and adapt in a way that is the best for your body. Hopefully, this video motivated you to do just that, because that is my mission, to help build a community of people who shine from the inside out, who unleash their inner light and their inner power to be the best versions of themselves, just like I'm trying to do every single day. It's not easy, and there's ups and there's downs, and you're continuously learning, and science is changing, and one day it's good to eat this, the next day it's bad to eat this. I get it. However, every day you wake up, you do the best that you can, you try to do the most right thing and take the most right actions. You're going to see the beauty all around you. Your light shining gives people permission around you to shine as well. So thank you for listening. Thank you for being a part of my community. If you like this video, hit that thumbs up or that subscribe button or whatever, and leave a comment below if you have questions or if you want me to do a video on any other topics in the future. So thanks for joining, and I hope you have a great rest of your day. Shine on, my beautiful friends.